Have you ever noticed a itchy red welt suddenly appearing on your child's skin and wondered, what is going on here? I'm Dr. Mona Amin, a board-certified pediatrician and mom, and today we're diving into everything you need to know about hives, what causes them, how to manage them, and when to worry. If you're new here, be sure to hit that subscribe button so you don't miss out on more videos that help you navigate your child's health, development, and behavior with confidence. Let's get to it. First off, what exactly are hives? Also known as urticaria, hives are raised red and super itchy welts that can pop up anywhere on the skin. They can appear in all shapes and sizes, small dots or large blotchy areas, and they might even move around. Hives are surprisingly common in kids. About 20% of kids will experience hives at some point. So if you're dealing with this now, you are not alone. Heck, I get them as an adult too, and chances are you have as well. Chronic spontaneous urticaria, or CSU, is a term you might hear, and it simply means hives that last for more than 6 weeks without a clear trigger. Unlike allergic hives, these aren't caused by food or environmental allergens, but rather by an overactive immune system that releases histamine unpredictably. Hives in kids can be alarming, especially if it's the first time you see them, but most of the time, they're caused by something way more common than you'd think. Viral infections. Yes, just a simple cold or flu are actually the number one reasons kids break out in hives. Next up, food allergies, with top culprits like peanuts, eggs, and dairy. Environmental triggers like pollen and pet dander can also be to blame. Medications, especially antibiotics and ibuprofen, are big ones as well. Then there are insect bites, contact irritants like soaps, and even temperature changes. Yep, hot baths or cold weather can do it. And believe it or not, stress and pressure on the skin can trigger hives too. They do for me. But here's where it gets tricky. Chronic hives often don't have a clear trigger. Potential underlying causes can include autoimmune conditions, thyroid issues, physical stimuli like cold temperatures, autoinflammatory disorders, and even in rare cases, malignancy. But for most kids with chronic hives, the cause remains idiopathic, meaning we just can't pinpoint an exact trigger. The good news, most hives go away on their own, but stay tuned on when we would want you to get them checked out. So how do you know it's a hive? Think of them as your kiddo's skin throwing a surprise party, except no one invited the itchy welts. Here's what to look for. Hives are like shape-shifting bumps, raised welts that can be red or the same color as your child's skin, especially if they're more melanated. They might start in one spot, then pull a disappearing act and pop up somewhere else. Magic? Nope, just hives. Some hives are like those guests who pop in, grab a snack, and leave within minutes to hours. Others, called chronic hives, decide to overstay their welcome for weeks. The main event is itching. Some kids also get redness and swelling, but hives shouldn't be painful. If they are, something else might be going on. And remember, if you're finding this information helpful, don't forget to hit that subscribe button. I post videos weekly to help parents like you feel empowered about your child's health. The good news, like I already said, is that most hives can be managed right at home, and a few simple comfort measures can make a big difference. A cool compress can work wonders to calm the itch, and you can also try applying a little calamine lotion or a gentle hydrocortisone ointment or cream for extra relief. If the hives are widespread, topical ointments may not be ideal given the amount of skin involved, but over-the-counter antihistamines can help. For treatment, newer generation antihistamines like cetirizine, or Zyrtec, or loratadine, Claritin are usually preferred because they're less likely to cause drowsiness. Sometimes higher doses may be needed, but always check with your pediatrician before making adjustments. If antihistamines aren't enough, an allergist might consider other options like Xolair, an injectable medication used for chronic hives. Factors that can worsen hives include physical or emotional stress, I've been there, viral infections, exercise, and even hot showers. Keeping your child cool and calm and knowing their triggers make a huge difference in comfort. Let's talk about when hives might be more than just a nuisance. If you're unsure if it's a hive, seeking a clinician can be helpful. If you're absolutely sure it's a hive, you can monitor, but if your child has difficulty breathing or any eye, face, or lip swelling, it's useful to get evaluated quickly. Other warning signs include hives that come with fever, vomiting, or diarrhea. And if your child has chronic hives that stick around for weeks, it's a good idea to visit your pediatrician to rule out any underlying causes. Chronic hives or chronic urticaria last for more than 6 weeks and often don't have a clear allergen trigger. A medical workup for chronic hives may involve blood tests to check for autoimmune conditions such as thyroid dysfunction, inflammatory markers, and in some cases skin or allergy testing. If the hives persist despite treatment, a referral to an allergist or dermatologist may be needed for further evaluation and management. Sometimes hives can indicate a more serious problem or need further management. Always seek medical help if the hives are severe or keep coming back, if your child has trouble breathing or swallowing, or if over-the-counter treatments don't seem to be helping after a few days. If hives are interfering with your child's sleep or daily activities, it's worth reaching out to your clinician for guidance. And of course, if they are happening daily or often for more than 6 weeks. One of the best things you can do is keep a simple diary of what your child eats and does when hives pop up. Maybe it's a certain snack, a new laundry detergent, or even an intense game of tag in the grass. The more clues you gather, the easier it is to pinpoint the culprit. Hydration supports overall skin health. Think of water as a key player in keeping your child's skin resilient. While staying hydrated won't prevent hives, well-hydrated skin is less prone to irritation and may recover more comfortably if hives do appear. And believe it or not, stress can be a trigger too. Even little ones can get stress hives, so finding ways to keep things calm, like deep breathing, a few stretches, or even a silly dance break can really help. And like I mentioned, viruses or illness can also cause hives. Remember, our skin is our largest organ, so when we get sick, our skin can react as well. And also the stress of just getting sick can cause our blood vessels to dilate or vasodilate, leading to more blood flow to the skin, leading to hives. And of course, gentle skincare is key. Harsh soaps or lotions can make things worse, so it's best to stick with fragrance-free products designed for sensitive skin. Less irritation means happier skin and hopefully fewer hives. Here's the bottom line when it comes to hives. Remember, Hives. Hives are itchy, red, and raised patches on the skin. Infections and irritants can be triggers. Various treatments include antihistamines, avoiding triggers, and soothing creams. Emergency signs include swelling, breathing difficulties, or persistent hives. Seek medical help if symptoms are severe or persistent. With this information, I hope you feel more confident about identifying and managing hives and have a plan on next steps if you're concerned. Now that we've covered hives, I want to hear from you. Have you ever managed hives in your kids or yourself? I know I get them. Maybe your child gets them. What tips or questions do you have? Share your experiences in the comments below, and remember, myself and my team of medical and parenting professionals are in the comments section trying to help you with education. If you found this video helpful, please give it a thumbs up sign, share and subscribe for more content tailored to help you understand your child's health, development, and behavior with confidence. I hope I brought more confidence into your parenting journey. Stay informed, stay empowered, and I'll see you all next time. Stay well.